We need a healthcare financial reform that's critical because it's all about money. We need to improve the working conditions of our healthcare professionals. We need to improve the living conditions of our professionals and facilitate the return of those that have already drained out of the country. We have a very huge diaspora in Europe, America, and all over the world, in the thousands. We don't mind because they're not wasting their time abroad. They're actually acquiring huge amounts of skills in specialties and subspecialties. And so we consider it that we're loaning them to the world. But when you loan, you expect that to be paid back. And what is the payback? The payback is that one day, if we improve the environment in which they can work, all these extremely specialized and subspecialized professionals will come back home where they belong. I jackpot 4 times and I'm back. So it's not an unknown phenomenon. There's nothing wrong with going abroad to improve yourself as long as you can come back home. One of the key issues is around staff accommodation. And what we have done now in Lagos is we're trying to build staff accommodation close to most of our major facilities. And any of our new facilities, we're definitely building accommodation moving forward. We've learned from the past. And as you can see from this picture, the hospital is in the background, adequate, comfortable staff accommodation. Right now we're renovating the doctor's quarters in various hospitals. This is just an example of the Lagos Island General Hospital, where we're renovating the 10 floors of house officers, and this is happening across many of our general hospitals. Now we need to increase our human resources for health. We know that. According to the WHO, we should have 1 doctor for 600 population. So that means for Lagos, for Nigeria, we need about 300,000 doctors, but we only have 40,000. For Lagos, we need 40,000 doctors, but we only have 7,000. So there's a shortfall of 30,000 doctors in Lagos and a larger number of shortfall for nurses. So this is a huge number. And let me just say, for the record, that human resources for health shortage is a global phenomenon. It's not an Africa problem, it's not a Nigeria problem, it's not a Lagos problem. It is a global problem, it's a phenomenon. The problem is, however, that Europe and America are able to attract the doctors and nurses and professionals that we produce abroad because they seemingly have a better environment to work in. But things are changing fast. Lagos is narrowing that greener grass on the other side. The grass in Lagos is getting very green, and in fact we're beginning to experience doctors that are coming back. However, in the meantime, let me just highlight that many of our healthcare professionals are at high risk of experiencing burnout. Burnout is a phenomenon of excessive workload. So for every health professional we have in Lagos, they're doing the job of 10. So we need to be patient with our healthcare professionals. They're working under very hard conditions in terms of the numbers of people that they have to see on a day-to-day basis. In Europe and in other parts of the world, they're beginning to recruit robots. We haven't started that yet, but we're thinking about it. We might want to start building our robots in Nigeria. There's no reason why we can't do it. But however, for now, what the Lagos State government has decided to do, His Excellency has given us the approval to establish the standalone University of Medicine and Health Sciences. And this is a collaboration between the Ministry of Health, the Ministry of Tertiary Education, the Attorney General, Ministry of Environment and Physical Planning and Urban Development. And the strategy here is, typically, we've been training our professionals in the green circle, which is our tertiary hospitals. But we have the yellow, the red, and the blue. These are huge assets that Lagos has in terms of general hospitals, PHCs, and in fact, private sector hospitals, military security facilities, and many, many diasporians abroad who want to participate in delivering healthcare to Lagosians. So what we're going to do is we're going to decentralize the training of our healthcare professionals. from the green circle through the yellow to the red to the blue, which means that we will have access to a very large number of patients. So for example, in our general hospitals, we see year in, year out about 7 million patients a year. And in our primary healthcare facilities, we see about 13 million. So when you add 7 to 13, you're talking about 20 million patients in the public health sector alone in Lagos. That is enough to train thousands and thousands of medical professionals, because medical professionals are like apprentices. They need patients to learn. Doctors and nurses learn by the bedside. They learn in the clinics. They learn in the theaters. And if you don't have patients, you can't make professionals. But Lagos has millions of patients, and so it's an asset for us that we must capitalize on to become the center of medical professional development in Africa. So what we plan to do over the next 5 years is to increase our intake of medical applicants for medicine, for nursing, for dentistry, pharmacy, by 500 every year until we hit a target of 2,500, which is about 2,000 more than we are doing at the moment. We've drafted the bill. It's gone to the Lagos State House of Assembly. It was passed by the Executive Council. This is the fastest bill that I have ever seen. In less than a year, it was passed by the Lagos House Assembly. And so we're just waiting for the signature of Mr. Governor, and this concept will begin. This is how we plan to distribute the training. We will concentrate on nurses and doctors, pharmacists and nurses and dentists, and then there will be development of other cadres that support the health sector. So you might ask, where are the professionals that are going to train all these increased number of students? Well, we have them, actually. If you look at LASU, where we train at the moment, has 120 specialists, but if you look at our general hospitals alone, we have 250. So we have twice as many specialists in our general hospitals. And then we have our PHCs, our flagships, we have our senior registrars, we have our private sector, and we have the diaspora. So there are quite a number of potential academic professionals that can take on the responsibility of training professionals in Nigeria. We have about 3 more prototypes that we're working on. The Etiosa General Hospital, which will be behind the MCC at Ajah. We have adequate land there, and we've promised the citizens of Etiosa and Ajah that we're going to build them a general hospital. We won't do it in this dispensation, but we will design it and hand it over to the next dispensation. And just like we've done with successive governments, just like we did when we came into this dispensation, we carried on the unfinished projects of the last dispensation of Governor Ambode. The other prototype we're going to develop is the Lekki General Hospital. This again, the Lekki Peninsula is the fastest growing populated area of Lagos, and it doesn't have a major general hospital. And so this is a very important strategy for us in that massively expanding industrial zone of Lagos. We also are developing a new prototype for mother and child centers. We have 11 at the moment. We want to have 1 in each local government, so we're hoping to be able to complete this design and in the next 5 to 10 years fill up the spaces across Lagos. One of the things that we just did recently, I talked about increasing harsh environmental weather due to climate change. We're able to develop the Lagos State Health Adaptation Plan 2026 to 2030, a 4-year plan that is going to help us to strategically, according to a framework, develop a plan for adapting Lagos and mitigating against incumbent bad weather and extremes of climatic phenomena. And so we've just launched this plan, and we've established a climate desk. And in that climate desk, we're going to be working to unpack this adaptation plan. It is in keeping with the federal government. We just domesticated the Federal Health Adaptation Plan to protect against climate extremes. We've developed a health sector annual operational plan. We've developed another policy called task shifting, task sharing, which is a very important document. Because of the shortage of human resources for health, we're having to create an environment where we can move some responsibilities and tasks from one cadre to another, so that our professionals are not exhausted and overwhelmed while we're building up our health human capital in the health sector. Now we need to harness public-private partnerships. Here we have an example of a public-private partnership in the Lagos Island General Hospital. It's called the Omotunde Ajoke Code Hospital, where the private sector are going to transform this facility into a smart health cutting-edge facility. We're very proud of the Lagos State Comprehensive Cancer and Diagnostic Center to be built here in Alausa, just around the corner. This will be the most comprehensive cancer diagnostic center in West Africa. And we're about to break ground and start the construction of this multi-billion naira public-private partnership joint venture.